Good afternoon. My name is Wayne Bell. I'm a primary care physician in Bowling Green, Ohio. Have been here for the past 25 years. I plan to talk to you today about two major conditions affecting many people, type 2 diabetes and chronic obstructive pulmonary disease, and to talk to you about an exciting new program which has been initiated to be a preventative measure to help us understand you better and maybe help prevent things from happening to you in the future. As a primary care physician, I have been trained in Canada and graduated in 1972. Practiced in Canada for 23 years, moved to Bowling Green, Ohio in 1995, and have been employed by Wood County Hospital since that time. I am known as the national educator in diabetes, COPD, and asthma, and lecture extensively on all of these topics. Becoming a doctor was always a lifelong dream for me when I was growing up as a child. I always felt that I wanted to help people. I saw the effects of illnesses on different family members and felt that if I became a physician, I could perhaps help other people do a little better and prevent some of the things that did happen in my own family. The first of these conditions is type 2 diabetes mellitus. This is a condition that affects about 13% of our population in Ohio, with probably another 10% that are pre-diabetic. I'm here to tell you that this condition can be controlled. The mainstay of treatment, of course, is lifestyle management, appropriate eating, and appropriate exercise. But along with that, we now have a large number of oral medications and injections that use either singly or together in combination can control your diabetes. What we aim for is to get a hemoglobin A1c, which is the average of your blood sugar over the past 3 months, down to an appropriate level. Generally 7 or less, but that number can vary depending on your other medical conditions. With your help in controlling your eating, your exercise habits, and being compliant and taking medications as prescribed, your diabetes can be controlled. Number 2 is COPD. This condition, chronic obstructive pulmonary disease, has gone from the 5th to the 3rd biggest killer in the nation today. It is also one of the single biggest causes for readmission to hospital within 30 days after you've previously been admitted. What has happened with COPD is that we no longer diagnose and rate it and grade it just on what a pulmonary function test will show. We now look at two other things: the impairment that you have with COPD. For example, are you able to walk up a flight of stairs without getting short of breath? And exacerbation history, because every time you have an exacerbation that requires an admission to hospital, you destroy further lung tissue and it affects your life expectancy. Again, we now have a large number of appropriate medications that we use. The mainstay of COPD treatment, if you smoke, is to quit smoking, or if you can, get away from the noxious particles, fumes, and/or gases that cause things. Thirdly, I want to talk about the CPC Plus program. This is a program initiated by the federal government to look at prevention as an important part of your health care. Our practices in Bowling Green have been selected amongst the 2,400 practices in this country to participate in the CPC Plus program. What you will notice is that your doctor will ask you, or your caregiver, nurse practitioner, will ask you about prevention things. Do you smoke? Do you exercise regularly? Is your mammogram up to date? Is your eye appointment up to date? Are you taking your medication appropriately? Have you had any falls at home? All of these things we can use together with you to make sure that we prevent as many of these conditions as we can. In summary, these are two major conditions and a new program for prevention that is going to help you and your health care in the Bowling Green area.